Hello friends, in this video we will discuss GPSC Medical Officer Physiology questions of 2021 paper. So let's start with the first question. The best index of the preload is. So they are asking about the preload. So preload is the load which is present in the heart before the systole. So blood volume no, central venous pressure no, left ventricular and diastolic volume, this is true because the preload is the load which is present before the systole and at the end of the diastole. And pulmonary capillary wedge pressure is generally the pressure of the left atrium, not the left ventricle. So the preload is the left ventricular and diastolic volume. Answer will be option number C. In electrocardiogram, following correctly describes event that normally occurs during the PR interval. So if we talk about the ECG, PQRST, so they are asking about the PR interval. So the ventricles is contracting. So the contraction of the ventricle is shown by the QRS complex. There is no change in the voltage staging on the ECG. No, it is not related to the PR interval. The mitral and aortic valve both are closed. No. And the cardiac action potential passes through the AV node. Wait. If you can see that the option 4 is the cardiac action potential passes through the AV node. So here answer will be option number D only because the PR interval tells us about the conduction starting from the SA node to the AV node, and if any AV blockage is there, then the PR interval will increase. So the cardiac action potential passes through the AV node is represented by the PR interval. Answer will be option number D. Next question is, in patients suffering from the severe anemia on auscultation, physician often found systolic murmur. Which physiological event is responsible for this? So we know that in severe anemia there will be decrease in the RBC mass and decrease in hemoglobin also. Due to this, decrease in viscosity of the blood will be there. Now this decrease in viscosity will lead to the thinning of the blood, and due to which turbulence will be there. So which is generally represented as the systolic murmur. So if we talk about the option, then anemia is more frequently associated with aortic stenosis. No, this is not true. Turbulence occur more frequently as diameter of the vessels is increased. No, turbulence is there but not due to the increase in the diameter of the vessels. So this is also a false statement. Turbulence occur more frequently as viscosity of the blood is decreased. So this is true because we know that we have already discussed that in severe anemia, decrease RBC and hemoglobin will lead to decrease in the viscosity of the blood, due to which thinning of the blood will be there and increase in turbulence will be there. So this is the correct option. And the fourth option is, turbulence occur more frequently as viscosity of the blood increase. So velocity of the blood increase. So this is not true. So here answer will be option number C. The turbulence increase due to decrease in the viscosity is responsible for the systolic murmur in the severe anemia patients. Next question is, patient suffering from chronic obstructive lung disease, which of the following increase in obstructive but not in restrictive lung disease? So if we talk about the obstructive lung disease, so changes are FEV1 decrease, FVC decrease, total lung capacity will increase due to retention of the air. So residual volume also increase. So FRC will also increase. Functional residual capacity will also increase. But these changes are not seen in the restrictive, because in restrictive lung disease, total lung capacity, residual volume, FRC, they all will decrease, and FEV1 and FVC will remain unchanged or they will increase. So if we talk about the vital capacity, so no, it is not increase in obstructive lung disease. Maximum breathing capacity, no, the breathing capacity generally decrease in obstructive lung disease or remain same. Functional residual capacity, yes, it is increase in the obstructive lung disease, and FEV1 it will decrease. So here answer will be option number C, functional residual capacity will increase. Next question is chemoreceptor, peripheral and central both. They are asking about peripheral and central both may contribute to increased ventilation that occur as a result of. So first is a decrease in the arterial oxygen content. No. A decrease in arterial blood pressure. This is also not true. A decrease in arterial oxygen tension. This is not also not true. An increase in the arterial carbon dioxide tension. This is true, because carbon dioxide changes are responsible for activating the chemoreceptor both in the peripheral and the central part of the body. So here answer will be an increase in the arterial carbon dioxide tension will lead to the increased ventilation which occur due to the activation of the chemoreceptor in peripheral system also and the central system also. GH has its effect on growth through. So growth hormone effect through, this is a direct question, growth hormone act through insulin like growth factors. So answer will be option number B, insulin like growth factors. The endometrium increase in thickness to 5 to 6 millimeters the week after ovulation. So they are asking after the ovulation increase in the thickness of endometrium is there. What stimulates this increase in the thickness? So this is again a direct question. We know that after ovulation the predominant hormone after the ovulation is the progesterone, and it is also it is only responsible for the increase in the thickness of the endometrium. So here answer will be progesterone from the corpus luteum. Progesterone is the only hormone which is responsible for maintaining the endometrium, and sudden decrease of the progesterone will lead to the menstruation. A defect in which gene of the Y chromosome leads to male child born without penis and testes. So we know that for the male child born without penis and testes, generally the SRY gene on the Y chromosome is defective. So SRY gene which is present on the Y chromosome is defecting, and generally it has effects on the Sertoli cell. So proper stimulus will not be given to the Sertoli cell, will lead to the male child without the penis and the testes. So here answer will be SRY gene. What is the SRY gene? SRY gene is the sex determining region on the Y chromosome. 2-point discrimination, ability to detect 2 points simultaneously applied to the skin, is based on which physiological mechanism? So this is again a direct question. 2-point discrimination is based on the lateral inhibition. So whenever talk about the skin, this is the skin. So if we provide any stimulus to any point, so the excited neuron will lead to the inhibition of the nearby neuron. So we will sense only those only the point which have the excited neuron. We will sense this the stimulus from this neuron only, and the nearby neurons are inhibited through the lateral inhibition. So this will lead to the this is the reason for the 2-point discrimination. So here answer will be C, lateral inhibition. We do not feel our clothes once they are put on because they activate the tactile receptor, which are rapidly activating receptor. This is true. No receptors are present over the skin to sense. This is false. They fail to generate the activity in any of the cutaneous receptor. This is also not true. Cutaneous receptor do not respond to the stimulus. This is also not true. So here the best answer is they activate the tactile receptor, which are responsible for the which are the rapidly adapting receptors. So here answer will be option number A, which is the correct answer. Next question is the function of neocerebellum is. So if we talk about the neocerebellum, then the function of neocerebellum is planning and the programming of voluntary movements. So option number D will be the correct answer. But if we talk about the maintenance of equilibrium, then it is done by the vestibulocerebellum, And if we talk about the maintenance of the muscle tone, then it is done by the spinocerebellum. And planning and the programming of voluntary movements is done by the neocerebellum. So answer will be option number D. Cerebellar connection to other parts of the brain is projected through which cell? So this is again a direct question. We know that the only output from the cerebellum is through the Purkinje cells. So here answer will be option number C, Purkinje cells. Which of the following is not true for an REM sleep? It is deeper than REM sleep. This is true. It is associated with dreaming. No, this is not true. Dreaming is seen in the REM sleep. And sleep comprises 75% of the sleep. This is also true. And sleep normally begins with NREM sleep only. This is also true. So here answer is it is associated with dreaming. This is not true for the NREM sleep. Amount of gastric juice per day is, so this is again a direct question. It is 1500 to 2500 ml. So generally in the Gujarat medical officer exam or any kind of state medical officer exam, most of the question are directly fact based question or the one liners. Human milk is different from cow's milk. In this regard, following statement is true for milk except. So they are asking that all the statements are true except. So contain less protein, this is true. Contain more carbohydrate, this is also true. Contain more fats, this is not true. Generally the fat content is equal or lesser, and contain more salt and calcium, this is also not true. So here two answers will be there, option number C and D, because but the according to the official answer key, option number D is given as the correct answer. So they have not considered option number C as the correct answer, so we will follow that only. So answer will be option number D. But option number C is also incorrect, because human milk do not contain more fat than the cow's milk. 98% of the total body potassium is intracellular, chiefly in. So this is again a direct question. We know that the maximum potassium is present in the muscle cells. So here answer will be option number C, muscle cells. Maximum digestion of carbohydrate is in which part of the intestine? Again this is a direct question. Digestion of carbohydrates mainly occur in the jejunum and the proximal ileum. So answer will be option number D. So next question is transient neutrophilia is caused by all except. So first option adrenaline, this is true. So firstly we have to talk about the neutrophilia. What is neutrophilia? It is an increase in the neutrophils. Now first option adrenaline, this is true, and corticosteroids also lead to the neutrophilia. Thyroxine generally do not lead to the neutrophilia, and exercise will lead to neutrophilia. So here answer will be option number C, thyroxine, which will not lead to the neutrophilia. First urge of micturition comes at. So they are asking about the first urge of micturition. So this is again a direct question. Answer will be option number C, 150 ml. After the filling of the bladder by the urine till 150 ml, there is no urge. After even an increase in the small amount will lead to urge of the micturition. Lifespan of fetal RBC is, so fetal RBC generally is 2/3 of the adult RBC. So here answer will be option number D. So if we talk about the adult RBC, then it is 120 days. So fetal RBC is generally about 60 to 70 days. So here answer will be 2/3 of the adult RBC. So these all are the questions which are asked in the physiology in 2021 papers, and most of the questions were very direct question, one liners were there, and so we have not discussed them in detail. And for any kind of state MO exam or any kind of state MO exam, generally the questions were direct or the one liners, so you have to read the fact based question one liners and not go into the detail of any topic. So we will also discuss other subjects in the upcoming videos, so you can watch those videos also. Thank you so much.